This training will review Providence House's policies and procedures pertaining to the management and prevention of communicable diseases. But what is a communicable disease? A communicable disease is a disease that spreads from one person or animal to another. The terms communicable disease and infectious disease are often used interchangeably. Pathogens such as viruses, bacteria, and fungi cause these diseases. But how can we try to protect ourselves from communicable diseases? Universal precautions are preventative measures taken to reduce the transmission of diseases and infections. Universal precautions should be used at all times by all staff and volunteers. Universal precautions apply to blood, other bodily fluids containing visible blood, semen, and vaginal secretions. Examples of universal precautions include proper and frequent hand washing, proper cleaning, disinfecting, and sanitizing, use of personal protective equipment or PPE such as masks, gloves, or gowns, and proper cough or sneeze etiquette. If possible, use your sleeve or elbow to cough or sneeze into. If your hands are used, avoid touching surfaces and wash them immediately. What guidance do we have regarding universal precautions? CARF requires that organizations have written procedures that address how communicable diseases are managed within the organization and that staff are trained on these procedures. This training fulfills that requirement. ODJFS requires that universal precautions be followed when caring for children with symptoms of communicable diseases, including monitoring them in an isolated room to determine if medical attention is required. This training will provide an overview of the policies and procedures that have been put into place at Providence House to fulfill these requirements. What are the recommendations from the Center for Disease Control and Prevention, or CDC? All child care staff and volunteers should routinely use appropriate barrier precautions to prevent skin and mucous membrane exposure when in contact with blood and other bodily fluids of any client. Gloves should be worn for touching blood and bodily fluids, mucous membranes, or non-intact skin of all clients, and for handling items or surfaces soiled with blood or bodily fluids. Gloves should be changed after contact with each client. Gowns or aprons should be worn during procedures that are likely to generate splashes of blood or other bodily fluids. Hands and other skin surfaces should be washed immediately and thoroughly if contaminated with blood or other bodily fluids. Hands should be washed immediately after gloves are removed. Although saliva has not been implicated in HIV transmission, to minimize the need for emergency mouth-to-mouth resuscitation, mouthpieces, resuscitation bags, or other ventilation devices should be available for use in areas in which the need for resuscitation is predictable. What is the guidance for hand washing? Hands should be thoroughly washed for at least 20 seconds with soap and warm water. Make sure to wash between fingers, on wrists, and under fingernails, paying special attention to the backs of hands and wrists. Rinse hands while leaving the water running. Dry hands on a single paper towel, using this towel to then turn off the water faucet. Hand washing should occur in the following circumstances: upon entering and leaving the facility, after using or assisting a child to use the restroom, before and after administering medication, before and after changing diapers, before and after handling or eating food or feeding any child, after coming in contact with bodily fluids, after using cleaning and disinfecting solutions, after working or playing outside, after touching skin sores, blood, mucus, saliva, urine, feces, vomit, or eye discharge, after handling soiled clothes or bed linen, and after handling animals. The guidance for using gloves, masks, and gowns are as follows. Gloves should be worn for touching blood and bodily fluids requiring universal precautions, mucous membranes, or non-intact skin of all clients, and for handling items or surfaces soiled with blood or bodily fluids to which universal precautions apply. Gloves should be changed after contact with each child. Hands and other skin surfaces should be washed immediately or as soon as child safety permits if contaminated with blood or bodily fluids, requiring universal precautions. Hands should be washed immediately after gloves are removed. Gloves reduce the incidence of blood contamination of hands, but they cannot prevent penetrating injuries caused by needles or other sharp instruments. Masks and protective eyewear or face shields should be worn by workers to prevent exposure of mucous membranes of the mouth, nose, and eyes during procedures that are likely to generate droplets of blood or bodily fluids requiring universal precautions. Gowns or aprons should be worn during procedures that are likely to generate splashes of blood or bodily fluids requiring universal precautions. Per Providence House policy, workers who have lesions or weeping dermatitis should refrain from all direct client care, food preparation, and from handling child hygiene and first aid activities until the condition is resolved. We will now address disinfectants. Contaminated objects and surfaces should always be cleaned with the appropriately supplied disinfectant cleaner. This includes changing tables, dinner tables, and bathtubs. Cleaning equipment, cleaning agents, aerosol cans, or other chemical substances should be stored in the original containers or clearly labeled and not accessible to children. All cleaning supplies shall be locked in a cabinet, drawer, or room when not in use. Acceptable cleaners are those that are provided by State Chemical and other cleaners that are found in the MSDS book where cleaners are stored. Bottles must be labeled and are available in all work and childcare areas requiring disinfecting. Blood spills should be treated cautiously and decontaminated promptly. Disposable gloves shall be worn while handling any spills of blood and other bodily fluids, such as bloody diarrhea, bloody nose, etc. Contaminated surfaces shall first be cleaned with hot soapy water and then disinfected with the provided cleaning solution. Hand washing with soap and water must occur after cleaning any spill. Management of human bites. If a bite occurs, routine medical and surgical therapy, including an assessment of tetanus vaccination status, should be implemented as soon as possible, since such bites frequently result in infection with organisms other than HIV and HBV. Victims should be evaluated as described above for exposure to blood or other infectious disease. Lice protocol. If a child has lice at intake or during the service period, over-the-counter treatment will be utilized prior to triage to reduce the risk of spreading lice. If the treatment does not clear the lice, then a prescription or repeat dose of the over-the-counter treatment can be utilized after 7 days, and/or as directed by the Metro Health Medical Center nurse practitioner. If a child is under 2, a prescription must be issued. Homeopathic methods can also be used following treatment, such as putting mayonnaise or a 1-to-1 ratio of water to vinegar on the hair, wrapping it, keeping it on the hair for 30 minutes, and then washing it out completely. All children with lice should have individual lice-specific combs. A child's hair should be washed daily and combed in 1-inch segments at least once per day, continuing several days after all live lice and eggs are visibly gone. All bedding will be washed daily, separate from other laundry daily. Children should never share towels, stuffed animals, clothing, hats, or pillows to reduce the risk of transmission. If possible, all children with head lice should be in the same bedroom. Furniture and carpet spray can also be utilized on surfaces and furniture that cannot be washed. Trash, housekeeping, and laundry. Cleaning and laundry supplies, except bleach, may be stored in an unlocked storage space and apart from food. Garbage cans must always have lids and plastic garbage bags to line the inside of the garbage can. Surfaces such as walls, floors, and other surfaces should be cleaned routinely. Any bedside tables, dressers, and flooring in children's bedroom and bathroom areas should also be cleaned on a regular basis, at least once per month, when soiling or spills occur and when a child is discharged from Providence House. Scrubbing vigorously adds to the effectiveness of the antimicrobial effect of the cleaning agent used. Any toys or items placed in a child's mouth shall be cleaned and disinfected with an appropriate germicidal agent and rinsed with water at least daily and immediately if soiled with blood, feces, urine, or vomit. Disposable gloves should be worn while handling linens or diapers soiled with bodily fluids. Soiled linens and diapers should be handled as little as possible and with minimum agitation to prevent contamination of the air and staff handling the linen. All soiled linen should be taken directly to the laundry areas and should not be stored or rinsed in child care areas. All soiled linens should be washed on a hot water cycle with appropriate detergent or thrown out if they cannot be cleaned. What are the procedures for caring for a sick child? Based on the present symptoms, the shift supervisor may need to isolate the child from other children and follow the communicable disease procedure. If a child needs to be isolated, the child shall still receive all meals, proper supervision, and activities to ensure appropriate care of the child while the medical condition is being addressed. A mildly ill child will be monitored closely by assigned child care staff for symptoms that would indicate the need to isolate the child. If this child does not feel well enough to participate in daily activities, he, she, they will be allowed to rest or sleep in his, her, their bed and will be monitored closely by child care staff. Staff will check on the ill child every 15 minutes and will document observations on the sleep isolation log. Additional comments should be documented in the child's daily shift report and on an illness symptom tracker. The shift supervisor, with consultation from the assigned social worker or program team member on call, will determine if the medical condition can be treated at Providence House. If it cannot be treated at Providence House and is not an emergency, the assigned social worker will schedule a sick child appointment at Metro Health Medical Center. If it is deemed an emergency or a sick visit cannot be scheduled, the child should be transported to the Metro Health Medical Center Emergency Department, Urgent Care, or RAP, and child care staff must accompany the child. The shift supervisor will arrange for floor coverage and staffing to the medical appointment with the support from the nursery operations manager. If a child has a communicable disease, including vomiting or a fever, the child should not attend school or daycare until symptom-free for 24 hours or otherwise indicated by a licensed healthcare provider. If a child is sick with gastrointestinal issues, the brat diet should be used: bananas, rice, applesauce, and toast. Children should resume eating a normal, well-balanced diet within 24 hours of getting sick, since the brat diet is low in fiber, protein, and fat, and should not be the child's only source of nutrition. The child should be encouraged to drink fluids to avoid dehydration and utilize Pedialyte or other sources of electrolytes as recommended. When a child shows any of the following communicable disease signs and symptoms, the child must be immediately isolated and medically assessed by the Metro Health nurse practitioner or taken to the Metro Health Emergency Department if symptoms worsen. These symptoms include diarrhea that is more than one abnormal loose stool within a 24-hour period, unusually gray or white stool, unusually dark urine, severe coughing that causes the child to become red or blue in the face or that makes a whooping sound, difficulty breathing or breathing becomes rapid, wheezing, yellowish skin or eyes, conjunctivitis, fever of 100.4 degrees Fahrenheit with other signs of illness, stiff neck, or untreated infected skin patches. What are the procedures for handling communicable diseases? A child isolated due to suspected communicable disease shall be isolated in one bedroom at Providence House. Remove all other children from the room to prevent exposure and transfer of illnesses unless also diagnosed with the same condition. If the child cannot be isolated to his, her, their own room, the child shall have a designated area and bed within the room. Assign staff as needed for care. A child's parent guardian shall be notified immediately if a child is ill enough to be isolated from the other children or if the child needs to be transported for a medical appointment. Children placed in isolation due to suspected communicable disease shall be cared for in the indicated isolation rooms at Leo's house or at Elizabeth's house, and staff must use universal precautions. Children who are exhibiting signs of illness should be made comfortable and should be placed in his, her, their bed in the isolated room with both a pillow and a blanket. Staff will check on the ill child every 15 minutes and will document observations on the sleep isolation log, while documenting additional comments on the child's daily shift report. Child care staff should carefully observe the child for worsening symptoms and will communicate any worsened condition to the shift supervisor or assigned social worker. Child care staff must disinfect the bed with an appropriate germicidal agent following the conclusion of the illness, or as appropriate. If the bed or linens have been soiled by bodily fluids, blood, or feces, they should be washed with soap and water, then disinfected with an appropriate germicidal agent. The assigned social worker will call and make a clinic appointment if needed at Metro Health Medical Center, or will call 911 if necessary. If the assigned social worker or other social workers are unavailable, then the shift supervisor will make an appointment or call 911. The shift supervisor will arrange for floor coverage and staffing to the medical appointment. Staff will document any non-routine medical visit on a critical incident report, and parents' guardians should be notified within 24 hours of the visit. Signage. When the presence of a communicable disease has been confirmed, signs should be posted at the entrances to alert staff and visitors to take precautions. Pre-populated signs are available on the shared drive for the following diseases: lice, pink eye, ringworm, RSV, and scabies. An editable blank sign is also available to create a sign for any disease not listed above. Here's an example of a sign that indicates there is a confirmed case of pink eye at Providence House and alerts others to take necessary precautions to prevent transmission. That concludes the training on the management and prevention of communicable diseases. While communicable diseases cannot be completely avoided, hopefully you have a good understanding of what we can do to manage the spread of them. If you have any further questions about the management of communicable diseases, please reach out to the assigned social worker if it is regarding a specific child, the director of facilities if it is regarding the chemicals, and either the compliance and quality manager or the director of programming and clinical operations if it is regarding the policies and procedures.